Thank you to everybody. Hello to everybody. Thank you for joining us today. Today's webinar coincides with the World Continence Week. Most of us know and understand the drip, but for many men treated with prostate cancer, continence can be a serious challenge. My name's Matthew Britland. I'm really looking forward to moderating today. I work for my own consulting company called Pharmaceutical, who focusing on patient engagement. I've had a lot to do with PCFA over the years. I actually started as a nurse specialist 25 years ago in cancer. I retrained in medicine and pharmaceutical medicine, and was working in the pharmaceutical industry for many years, developing a lot of these the medicines that are used. The discussion we've got today is a sort of good news discussion, we hope. Incontinence can be treated, and that's what we're going to be talking about today. We're going to really be talking about what men or carers can do themselves to really tackle continence. Today, to lead the discussion, we're joined by Clinical Development Manager at Essity, Newby, PCFA Clinical Nurse Manager, Debra Ward, and prostate cancer survivor, Ian Reid. So we're going to go straight in. We've got some questions to start up, and we're going to go around the room. And then we've also got some questions which were posted prior to today as well, which will finish us off on. So let's get started. Deb, could you talk us through the different types of concerns men face after treatment?
Yeah, absolutely, Matt. Thank you. So we get a lot of calls from men even before having treatment for prostate cancer, and then afterwards, just about, will I be wet and how long will I be wet for? And this is a very individual scenario. Just to go back, I guess, to basics. So the definition that we use for incontinence is the involuntary or accidental loss of bladder or bowel control. Our bladder and urine, retaining urine really needs certain things to be in place, and many of these are impacted when men have treatments for prostate cancer. So you do need a satisfactory storage of urine. So men generally will hold about 400 to 500 mils for a healthy bladder. They need intact nerve pathways, so from the brain to the bladder, and then from their bladder to the sphincters that hold and control the urine. They need adequate muscle strength in the bladder and the pelvic floor. And they need their valves or the urethral sphincters to relax and allow urine to flow at convenient times when they want it to. Now, there can be several causes for incontinence after prostate cancer treatments. There can be urge incontinence, where people get sudden or strong need to urinate. There can be stress incontinence, where they get loss of urine at times when they have activities such as coughing, sneezing, laughing, walking, lifting. There can be a mixture of these, and there can also be nocturia, where they get the urge to get up overnight. The prevalence is quite significant. So in the general population in Australia, 1 in 4 people of the ages of 15 and over do have some degree of incontinence. So it's not an unusual thing, but it's something that we just don't talk about generally. So that's about 5 million Australians have some level of incontinence. The bother is the thing that generally makes people seek assistance. So for some people, they're not bothered by their level of incontinence. For some people, they can have, a very little incontinence, but it bothers them, so they go and seek help. So whatever level it is for you, if it's bothering you, then that's when the time is to ask and get treatment. The causes, so the physical causes after any type of surgery, so whether you've had robotic or open or laparoscopic, and any type of radiation, can result in temporary and in some situations longer term of urinary incontinence. The side effects are associated because of the controls that we've already mentioned. It's not anything that the man has done or hasn't done. We do know that doing pelvic floor exercises can be of help, but it is the actual treatment itself that is causing these changes in the bladder and the urine flow structure that causes the incontinence. The callers that we get to the telenurse service really are very feared and find these side effects very distressing, and they do sort of try and find ways that they can manage it themselves, and then they'll seek help. So which is sort of, I guess ideally they would seek help first. So we have to provide reassurance about normalising this. It is something that is to be expected, and by understanding that it will get better, and that your medical team are there to help you with this, is something that we place very high importance on. The psychological impact on top of the physical effects is also quite significant. So the distress is the word that we often refer to, associated with urinary incontinence, is quite significant on men's mental health. It can affect the amount of physical activity that they do, because they don't want to go out in case they have an accident. Accessibility to toilets, so there's that fear of, oh, I need to go now, I have to rush, and where is the closest toilet? Having to carry supplies like the pads and changes of clothes can be difficult, and then they avoid these scenarios and activities, and that can really affect the way that they feel. In fact, we know that 70% of people with incontinence do not seek help, which we clearly want to try and change. Incontinence can have some long-term physical and emotional impacts on self-esteem, motivation, and independence.
Wow, I had no idea it was 1 in 4. That's 5 million people. I think I'd love to come back at the end actually to the pelvic floor exercises, and if any listeners are listening into this and they want to start doing the pelvic floor exercise, it might be good to get your advice at the end on where to start with that. I've moderated 3 or 4 of these PCFA vodcasts over the last few weeks, and one thing that's really coming through strong is the fact that we don't talk about it. We don't talk about erectile dysfunction. We don't talk about continence. We don't talk about all the stuff that actually we really do need to talk about. So thank you for that. We'll certainly definitely be coming back, Deb, to that. It's clearly a big issue, impacts them numbers. I had no idea 1 in 4 and 70% don't seek attention. That to me, there's a huge call to action. There's obviously things men can do through recovery and rehab. Karen, we'd love to talk to you a little bit about the options for continence products in particular, and garments, and are there schemes available, for example, to help men cover the costs?
Yeah, great. Thanks, Matt. So I'm Karen, and the clinical development manager for Essity, and the TENA brand is the brand that I work with very closely. And I think, when we're looking at, the continence aids, and there are so many out there, there's lots of brands and styles, and it really is a couple of things to, consider when choosing the right continence aid for you. And one of the big thing there really is a product that's going to keep you dry. And of course, if urine is left on the skin, it can then cause some skin irritation. So by having a product that absorbs the leakage is really important, and that it fits properly. And the other thing is, these the continence aids can prevent odour as well. So when you've had your surgery, or you're getting your treatment, it's always comforting to know that there's no odour there. So a lot of the products have these little crystals, if you like, inside, which are called polymers, and they absorb the urine, but they also prevent odour. So that's a good thing to know. And also the dignity, when you're wearing a product and it's allowing you to get on with your life, and things like, getting to the appointments after surgery or your treatments is really important. And, feeling comfortable, some people need to, catch the public transport, all of that. So it's important that, that you are going to your appointments, and if you have leakage, it's really important that you feel comfortable in what you're wearing, and socializing, and also, those getting to the gym and the exercise and all of those sort of things. It's really important. So choosing the right product is can be a little bit of a minefield. And basically there's 4 styles of product out there from a continence aid point of view. And there's some really, light products like the shields for just some minor drips. But, there's also some higher absorbency products like the guards, and got just a couple here. And they come in all different absorbencies and lengths and widths to ensure that, you're not overly prescribing, we call it. So you're not wearing a product that's too big, that you are wearing a product that is, for you and where you are in your journey as well. And keeping an eye out on the leakage, and working very closely with your healthcare practitioner, and moving around with the products from absorbencies and sizes. There's also pants out there. So if you're looking for something a little bit easier, rather than wearing a product inside your underwear, then there are some lovely products now in the market that you can wear. So these ones are the Men Active Fit. So they're like a navy colour. And then there's also this one here, which is the level 4, which is, like a grey stripe. So we're really looking at, what consumers are needing as far as, maintaining their dignity, having more of a masculine product for them. And the other really cool thing that's, hitting the market as well are the washables. And, you're starting to see a lot more of those in the market as well, where people are choosing now to, purchase these a little bit higher investment, and then, washing them themselves. So lots to choose. And a couple of, little tips there is, you may not have the same product for different parts of the day, and depending on what you're doing. So if you're at home or at work, and your activity levels. So if you're finding, you've got a little bit more stress incontinence, for example, while you're at work, you might want to have a higher absorbency. So, little things like that can really, make or break your day. But, and you can also test the absorbency and, how you are progressing. So you can weigh the pads. So that way you've got a good idea of, where your leakage, is, especially if you're doing all those wonderful exercises, your pelvic floor exercises. You want to see, the progression there. And I've had a few gentlemen also let me know that, they do the underwear test, which is, not wearing a product at home and just seeing then, on their underwear, if they're sort of at that, they're not quite sure if they're leaking or not. And that's a really good way then to sort of test, where they are in their journey. And I think sizing and fitting is really important too, to make sure that, you know, if you are wearing the guards or the shields, that you do have firm fitting underwear, that they're not loose. And you want it comfortable against the skin with no gaps as well. And that can be, you know, if it's a long-term solution, then, you know, when the weight is increased or decreased, it's really important then to make sure that the underwear is fitting properly to prevent the friction and chafing and leaking. If you're wearing the washables or any sort of pants, it's really important to get the waistband measurement right. And the waistband measurements are on the packaging. Otherwise, you can go to the website, which is tena.com.au, and you can look at the actual waistband sizes there as well. As far as financial help in Australia, there are quite a few schemes out there to assist people that, you know, really need that extra help. It's not a cheap exercise with continence aids. In Australia, we do have the federal funded program, which is a continence aids payment scheme, as well as the DVA rehab appliances program and the National Disability Insurance Scheme. And really, in Australia, it's so great that we also have state-based schemes as well in each of the states, which is fantastic. The way that you can access those is you talk to your healthcare professional, so they can make the assessment, see if you're eligible, and then they can then help you with that funding. So it's, you know, there's some help out there for those that need it as well. And I think that's all I really wanted to say today. There's lots of support out there. Our website has, you know, heaps of information on products, selecting the products, and there's free product samples there as well. And I think that is the key to actually getting, you know, what you need is to try different styles, you know, and in different situations. Without, you know, buying a whole box that you may not use. So that's there for you as well. And the Continence Foundation of Australia have, you know, really good information there, especially on the funding schemes as well. Okay. Thank you, Matt.
No, thank you. That was amazing. And it's incredible to see how far we've come helping men manage urinary and bowel challenges. I do want to get to, you know, how do we raise the awareness? Because I suppose that if people are not seeking help, there's probably a lot to do with that one. But before we get to that, I'd love to turn to Ian as a survivor who understands exactly how challenging continence can be. Ian, could you tell us candidly about your experience with all of this?
Well, I couldn't spell incontinence when I first diagnosed with prostate cancer. It was one of those, I think for me and my background and my work environment, it was one of those things that just didn't surface, you know, and it was frightening. It was actually nearly as frightening as people, me having an understanding of what prostate cancer would mean to me. Up at this level, you can hear up the top all the words, all the phrases, all the descriptions, different types of surgery, which one works best. There was very little about the incontinence word. There was a lot about being fit, and I've been a cyclist all my life, and fitness has been part of who I am. I wouldn't say that I was a true athlete, but I'm a fit kind of guy, and I wasn't prepared, I think, for the journey to going from prostate cancer diagnosis to surgery to having to deal with incontinence in reality. Albeit not for a long time. That time was for me, I was fortunate. It was managed by being in a position where I wasn't actually working, which was a good thing. And I was home, so I was in a safe environment, if I can call it that. But if I'd been working my face-to-face, and I'm working now, is I work face-to-face with groups of 15 to 20 people. So it's for me, it's a pretty fearful exercise of this. Am I going to be leaking today? Which pads? Walking into the pharmacy to see, oh, well, there's pads. And, oh, hello, Mr. Smith, or my next door neighbour, or the neighbour down the road. What are you doing? I'm just buying some incontinence pads. That's a real conversation stopper. It's like, I'm not quite sure I know what to say after that.
Yeah, sure.
But that whole exercise for the surgeon that performed the work that was my prostate removal, he said, we're going to have a date of surgery, and he's called that November 2020, but your preparation is going to begin basically 6 months before that, which was a fairly intense physio program, lots of exercises, including pelvic floor, but a whole range of exercises based on strengthening the core, the body core, upper legs, and with weekly check-ins with the physio to ramp up the level of exercise that I actually, and effort and repetitions of exercises. And they were quite amazing. I think in hindsight, when I look back straight after surgery, those were the things that got me out of bed and enabled me to put a pad on and say, this is a temporary measure. This is not my life going forward. And his first question, the physio's first question every week after surgery was, so what are you wearing today? And I found that quite confronting to start with, but after going like, you know what, that's a really important question after several weeks and working through that situation of going, well, it's a pad and we just have to do well. It's either that or be damp. And being damp, being wet wasn't a very attractive proposition at all. I suppose in that space that went on for me for about 3 months after surgery. Following the surgery, sometime after that, I developed after 3 months, things got great. Things worked. No pads, just underwear. Karen's comment about trying at home, yep. Get the confidence levels up at home and then get out on the street afterwards in terms of being dry. But I had a hernia, possibly unrelated, possibly some relation to the surgery, which kind of rolled me right back into the incontinence space. And this time it was harder and tougher. And I found it very frustrating. And I called on both the specialist that I was under and a good friend who had some nursing in the incontinence space. So I found out in her career. And that was what got me to the point of understanding that it's all right to ask questions. It's all right to really I got stuck into the TENA information and found there was actually too much information for me to digest in the end without having this friend on the side who could help me out, a bit of a sounding board. That was that, and the ongoing desire to be dry and exercise was the one thing that the physio said, you keep doing this and you will get there. It's just about time. Well, that just about time for me nearly 2.5 years after the hernia surgery put me in the right spot where I can get outside in my underwear. That's a very attractive thing for me. And it's one of the things that listening to other friends of mine who have gone through prostate cancer, who are not fit, who don't identify with the need to be fit really, they struggle and they're embarrassed and their whole demeanour in life and outlook on life changes. That's quite sad considering how much information there is that people could access. And sometimes I might replace could with should access, because I think that there's still a lot of guys just from, I have a father of 2 mid-30-year-old sons, and many of their friends are like, prostate cancer, can't spell it, therefore it's not important. I'm saying, yeah, come on, guys, get yourselves down, get checked out. Now, don't wait till you're 40 or 50 or 60. And don't be afraid to ask questions. So got this kind of little clique building with a whole lot of different people. To come back to, so what does prostate cancer mean to me? How am I going to manage it? And why? And the exercise seems to be regular exercise in the core part of our body seems to be one of the most prevalent responses.
It's I think it's a really timely reminder, you know, when people who are listening to this, generally guys with prostate cancer, but it's the most, you know, just taken over breast cancer is the most common cancer in Australia. And it is one which can be so treatable if it's diagnosed earlier. And I do hope that we can really raise the awareness of prostate cancer as something. If ignorance is not bliss, ignorance just leads to the disease getting much worse and harder to treat. So, I mean, to have your voice today is so important, Ian. You're a great role model for all of us. And we'll come back to you. I'm particularly keen again when we talk about the pelvic floor to talk a little bit more about your exercising and what we can, you know, what advice you'd give to others. But before that, we just want to start talking about surgical options as well. There are, you know, a plethora, lots of surgical options out there for men. And Deb, I'm wondering, could you address this? What can men do if their incontinence doesn't improve or reduce over time with exercise and other things like that from a surgical perspective?
Yeah, sure, Matt. I think Ian covered really well the importance of exercise and those conservative measures that men really need to put effort into, particularly the first 12 months. So that generally is about the time when men would start having discussions with their medical team about, well, this incontinence is ongoing, and if there is that level of bother that is worrying them and affecting their quality of life, their mental health, that they do have those conversations, that the physio, you know, may have petered out and not improving anymore, got to a level whereby it's just sort of static, and so they are then looking at some surgical fixes to enable them to get back to the things that they want to do and not continue to live with the level of incontinence. Karen talked about the pad weights, and we do look at that significantly as a level for deciding on most appropriate surgical options. So generally in a 24-hour period, and we would get men to do what we call a bladder diary, where they actually write down when they're losing urine and what their pad weights are over a 24-hour period. And there's two main surgical options that men would fall into for assisting with their urinary incontinence outcomes, and they are the male pelvic sling, and that's generally for men that have a lower level of urinary incontinence, so generally less than about 200 mils in a 24-hour period. And these are stays in hospital, overnight stays in hospital, or maybe just a day stay, but definitely needing general anaesthetic for insertion. And the sling is where they wrap surgical tape around the urethral bulb, so that area where the prostate's been removed and the urethra leaves the bladder, and the surgical tape sort of lifts that part of the urethra into a new position to increase the resistance to enable them to better hold the urine in the bladder. There is some post-operative instructions. So there's a 6-week healing process whereby men are restricted after having this surgery. They aren't able to lift anything heavier than about 3 to 5 kilos. They do have to reduce their exercise and their activities. So no bike riding or climbing, squatting, no sexual activity during this time as well. And surgeons would, always provide instructions of these limitations. There is some pain involved at the site for a couple of weeks, generally just controlled with, medications that can be taken at home. And short-term reduction in urine flow is normal. So that flow might be reduced. So it may take a bit longer to go to the toilet, but it is a good solution for that sort of minimal to moderate urine loss. If men have a loss of urine, greater than that, so sort of, at least 300 mils or more, then they are looking at a slightly more involved surgery, which is an artificial urinary sphincter. So once again, it is, a day or an overnight in hospital. And this device consists of a balloon that's placed into the scrotum, and it activates a cuff that is positioned around the urethra in the penis, so all internal, and that's activated each time the man wants to empty their bladder. So it takes about an hour or so, that particular operation. And what happens is when the cuff is inflated, urine leakage is limited. So the man is actually taught to push the pump and deflate the cuff to allow the flow of urine. Then the cuff reinflates automatically after about 5 minutes, and this stops any further urine flow. The restrictions for men after this surgery are similar to the sling. So 6 weeks of sort of reduced activity to allow healing. There are some wounds in the perineum, so that area underneath behind the scrotum, and also the abdomen, and generally dissolvable stitches are used. A urinary catheter may be inserted after this operation just for a few hours, but generally removed before they leave hospital. And then the pump isn't actually activated for about 6 weeks, just to allow healing, so the man won't have any change in their urinary symptoms until that activation happens, generally back in the surgeon's rooms with his nurse or with him or her, at about that 6 week mark, 6 to 8 weeks, and then they are taught how to operate the device. Because it is an implanted medical device, they do get provided with an ID card, and they would, take that with them, so that if at any stage they do need to be admitted to hospital for any reason, that the staff are aware, especially in an emergency situation, because if they needed a catheter or something, the people need to know that there's a device there. Now, these operations are considered elective surgery, and so those men with private insurance will have more readily available access, and the wait time probably less, but it is available in the public hospitals, and so everyone should speak to their urologists at their ongoing reviews about their level of incontinence. As Ian said, the surgeons will ask, what level pad are you wearing, and being honest about how much bother this is for you, and what level of incontinence you've got, would then allow the team to triage you into that process for a surgical option, if that's something where you want to go. Okay.
I think we're going to address maybe a bit more on the surgical side later on when we get to the questions from the patients. So thank you so much for that, Deb. We've spoken about different types of incontinence and the management strategies, how it links to prostate cancer and treatments. I'd like to probably tap down a little bit about how incontinence can impact broader health, well-being for men, cost management, for example, ability to work, impacts around mental health, the other things, the things that really are valuable to men. Ian, 2023, do you think stigma is still a thing? And can you address, maybe from your personal experience and talking to other men with prostate cancer, how this might impact broader across the well-being of the men involved?
Yeah, well, firstly, it is still a thing, very much. But I think the most confronting element is prostate cancer to start with. And it's not until you're in that vehicle that you find there are things I was unaware of. Which I think comes back to probably, if you're in the wrong circles, you don't hear about prostate cancer. You just hear that people dropped off their perch or something similar. It's not a very nice expression, I suppose, but that's the reality. I find the reality. Many within the group I ride, there's 40 people I ride with, nearly all fellas, and it's about 8 of us have had prostate cancer, which is quite high. And of those, I've been privileged to have been able to talk to those men and listen to them as being advocates for early detection and willingness to stay fit. I don't have to go very far sideways away from that group to find that they're a unique group. And there are many others who I find in the workplace where I am today. I regularly have conversations with some of the young engineers about what's going on and why should I go and get checked, and what do you mean you're incontinent? I usually use the word leak. It's sort of a bit more expressive and much shorter, and they get the gist of that without having to ask any more questions. And it's like, but isn't that embarrassing? Well, yes, it is. It's very embarrassing. But the reality is that you can actually manage it. And you just need to go, I have a problem. If I cut my finger, I'll probably put a Band-Aid on it. If it's really bad, I'll get it stitched. So I try and apply that analogy to, if you've got a problem with leakage, how big is it? Are we talking half a teaspoon, 4 or 5 mils, or are we talking a cup? And if someone comes back to me and says, well, I'm talking about a cup, it's like, you probably need to find somebody to have a conversation. Can you talk with your GP? I find many of the fellows I talk with don't have regular doctors that they see, which I think is a problem because they don't have a relationship with their medical fraternity. Some of the ones who are involved with their, particularly in the public system, don't have the opportunity to establish a relationship, especially. And that's a bit sad. And it's too bewildering for some of the fellows to go, I'll just go and do some research myself, because they end up not knowing where to look or filling in the gaps on information. And I know there's a number of groups around the area that I live where men get together that might be in a men's shed per se, one of the men's shed, but they have conversations around prostate cancer, different treatments post-surgery, what are the problems, how can I rectify those? I hear things now really 6 years on from when I started my journey into the prostate cancer space, and identify with them better now than I did at the beginning. They just went straight overhead because I think there's that, it's hard to put yourself in someone else's shoes, but I think you need to, and I think people who've got the products and people are probably trying to do that all the time, but it is difficult. Stepping away from the brand and stepping up with just the solution would be really good.
In the sheds and the places where the guys hang out, do they talk about the impact on mental health, depression, and impact on relationships, impact on working? Do they address that much?
it'll come back to the individual men. Do they address it much? The answer is probably no, because men are funny things. We like to develop a relationship with somebody first before we can have that sort of discussion.
Yeah.
So either that, or if you've got somebody who's got a particularly a flair for dominating conversations, and every now and again I come across someone, it's like, I want to bottle what you've got. It's just awesome. They're such powerful people. They just speak, and they don't care who listens to them, but they speak well. And there's a couple of those sorts of guys around.
Yeah, hopefully we'll get more. And the continuity of care is, I think, an important aspect that you talked about when you've not got the same healthcare profession. I'd love to see more prostate cancer nurses in Australia in particular. They're not just these guys are therapeutic and medical experts as well. And I'd love to see more of that. Maybe we'll get to that shortly about prostate cancer nurses. I might just go to Karen. It's not always easy to start these conversations on incontinence or seek help for it, as we've seen. 70% of guys don't seek help. But over your many years both working as a nurse and an industry leader, have you seen much change, and what's your hope, I suppose, for the future?
Yeah, and I think what you're saying before is super relevant, whereas healthcare professionals, we see people when they're requiring that help, they've reached out, but I think it's people like Ian and the groups and the work that you do, on that grassroots level, that by the time they get to us, that, those conversations have been had. And, by the time they get to me with their, ready, it's like, tell me, what have you got? Like that back end work of the conversation, that initial conversation, or, how to even talk about, incontinence, the work from, the Prostate Cancer Foundation, the men's sheds, the Beyond Blues. There's a lot of really good work being done there. And I've noticed, in the past where I have visited the men's shed, and again, it's an awkward beginning, but, once the conversation has started and it's like, well, this is the topic of conversation, is very different, in a men's group where it's, very much, here's the topic and this is what we're talking about, and we'll stay on topic for, a while. When in a women's group, it's very different, where, you've got different conversations, and, it's like, spaghetti, it's all over the place, but we eventually, get what we need to talk about. With men, it's very topic focused. And I think, creating that awareness, and there's lots of ways to do it. We've had commercials where we started in like the humour, we're trying to bring in humour. And at that particular time, which was, probably about 8 years ago now, it seemed to hit the mark. But now we have our model at the moment, who is a gentleman, lovely man, who's, is a cancer survivor, prostate cancer survivor. And I think that seems to be where people are now, where they want real life stories. They want to hear from people like Ian, because it's relevant. It's not something, that, we're hiding from anymore. So I think there's, more of that to come as, conversations change around not only the topic of cancer, but then also the solutions around, the different ways to manage it. And I suppose that is, it's not a one size fits all. And that's where, the beauty of those conversations are, where men get to speak about, their experiences, and then they get to make choice. And really that's, really breaking down those barriers to to well-being. So yeah, I think for the future, I think we're right on track as, where it's becoming more, real. And I think with sustainability, coming into play as well, where people are looking for, raw materials, what are you using, from my perspective. And, that's even opening up the conversation even more now too. It's like, here's a little commercial break, now we're going to not talk about emotions for a minute, but let's talk about, what we're using in landfill and all those sort of things. So, and I think that just, helps the conversation as well.
Yeah, it is interesting. I've noticed the change, but it's also the epidemiology of prostate cancer has changed, and there'll be quite a lot as well on all cancers. A lot of prostate cancer is becoming diagnosed in men in much earlier stages of their life than when I was diagnosed cancer 25 years ago. 30-year-olds and 40-year-olds with prostate cancer. So it is interesting, and I think we are us blokes are starting to talk more about just things, hopefully anyway. We've only got 15 minutes left, and we really want to get to the Q&A, so I might if that's okay, go straight into the Q&As. We've got a guy has asked about his incontinence the last 6 years, had a radical prostatectomy. Got a question, maybe this is Deb, maybe you can just further talk about mechanical things outside of slings or taps, like urethral bulking, if you could maybe elaborate on that a bit more, and also any implications that might have, and also how do you get that interval billed, Medicare covered, etc.
Yeah, sure. So we talked about, I guess, the two sort of bigger operations, the slings and the sphincters, but there is a procedure of urethral bulking, which is where they use a topical injection of collagen or water-based gel, and it is inserted. Once again, it is a procedure to be done in hospital, where they insert these substances in the wall of the urethra, and creates a bulking or a tightening of the tissues as men age, and that elasticity and collagen depletes. Some of these things can be used, whether it's after prostate cancer treatments or not. This is a scenario of treatment. It's not used a lot. But it is something that is being used more in these sort of milder cases, in more older men that are still wanting to be active and not be reliant on pads. So they inject this material. It provides the additional resistance and closure of the urethra, making leakage more difficult.
Oh, okay. And how can people get access to them in terms of Medicare and such?
Yeah, so once again, it would be talking with the urologists that they may be seeing ongoing with their prostate cancer surveillance after treatments, and getting referrals into those centres that do them. They may find that they might need to perhaps travel to a larger centre where there are people skilled in these techniques. It might not be the local hospital, but there is a certain number that are provided Medicare coverage in the public setting, and they are definitely available in the private setting.
That's great. Thank you so much. Thank you. We've got a sort of part B to that question. I might come to Karen. This chap, he said he prefers to wear washable incontinence undies, but he does find that they smell when, even if they've been washed and hung in direct sunlight, they're still a bit stinky. So what advice have you got for this?
Yeah, there's a bit of a knack to the washables, but always, and obviously no brand is the same. So it's really important that you follow the label, and you'll find them, on the inside, on the back of the garment, and it actually says, how to actually wash it. And the International Continence Society also have a fact sheet on washables as well. So I'll send that to you. We can link it in the description. And basically they say to rinse the product as soon as you can. We don't need to soak it or in bleach or anything, but if they are smelly, it does mention to soak them just for 20 minutes prior to washing in a solution of 1 part vinegar to 1 part water, 3 parts water. And that is very old-fashioned, and you'll find if you talk to any people who are our seniors, they will definitely vouch for that. So, you know, that's just a little hint there. Making sure you wash them at around 40 degrees Celsius, and depending again on the manufacturer. And the other really important thing is to turn them inside out. So that's another. And as well as, you know, when you're washing, don't put fabric softener in, because it does actually coat, if you like, parts of the product as well. So then they're less absorbent. And then, of course, you know, that's when the odour can happen, and no bleaching. Good old-fashioned sunlight is important, and also hanging them outside as well. We don't need to iron them. And the other is they're good for about, depending on the brand, between 100 to 150 washes. So, you know, if they're a couple of years old, you may need to invest in a new pair. And that could be the reason they're not absorbing and being washed or rinsed properly. So, yeah, a couple of little tips there.
Yeah, they're amazing tips. I had no idea about most of them things. The vinegar and water reminds me of when I was very young. We used to use that for various things. Okay, Deb, for you, next bloke here is radical prostatectomy in November 2012, followed by a procedure to remove scar tissue in May 2013. He found this made his incontinence worse. To go through several pads a day until he had an artificial sphincter inserted in 2013. So a decade since that's been installed, he's not noticed any issues, but his question is, will there be any telltale signs that his sphincter is failing that he should be looking out for?
Yeah, okay. I mean, that's great that he's having improvement, and we do know that the satisfaction rate with those artificial urinary sphincters is very high. People, men are, you know, very happy with them if they go down that avenue to control their incontinence. So generally they would last around about that 8 to 10 year mark, but there are men that have reported good outcomes up to 20 years. So so it is just a matter of now he's 10 years after having it installed, sort of watching out for some symptoms. So those symptoms can include just the worsening of any level of leakage, maybe having difficulty in passing urine, so maybe having to squeeze a little bit more, and finding that even though the device is activated, there may be some level of obstruction, and is just finding it more difficult to pass the urine. There may be some scrotal inflammation, so because the device sits in the scrotum, there can be some tenderness or redness or swelling, and all of these things we would suggest he reports back to the urologist for review and assessment of is this time for that device to be replaced, and they absolutely can be replaced. You know, in most situations.
Okay, that's fantastic. Thank you so much. We've got one question a little bit about continence after pelvic floor exercises were unsuccessful, but I just wanted to throw a question in about pelvic floor exercises because it's been talked about so much. Maybe Ian, I might ask you this. Could you just explain when you were first talked to about pelvic floor exercises and what you wished you'd maybe known back then, and what advice you might give to other men who really want to try and optimize pelvic floor exercise?
I'd never heard of a man doing a pelvic floor exercise, with the possible exception of joining my wife on 2 occasions when she was carrying our sons.
Right.
And I went to birthing clinic, and it was like, now fellas, you won't ever need to do this, was the thing that the the lecturer said. And there I am sitting some 35 odd years later, listening to my urologist going, oh, you'll need to start doing your pelvic floor exercises before surgery. And I'm going, man, that's 30 years ago since I found out what they are. How do I find out what a pelvic floor exercise is? What's a good one? What's a bad one? How many times a day? Do I sit up? Do I sit down? Stand up, sorry, or sit down? And so it goes on. And the physio, who shall remain nameless at this stage, but he was awesome. He taught me what a good pelvic floor exercise was. He used an ultrasound to be able to show me how I could act on screen, live, how I could engage those appropriate muscles around the urethra to actually shut the gate, shut the door, stop the leakage. Said it won't cure it altogether, but now you understand when I say sitting down, this is how you engage a pelvic floor and perform a pelvic floor exercise that's going to work. I'm like, man, that's really good. We should do a video on this. He turned me down because he was doing a paper for studies at the time. But I think it should be some short clips that show that process. You don't have to see the person. You could just see the ultrasound screen and have a dialogue that says, here are all pictures, still static pictures of this is a good position to do your pelvic floors. It's very different to the ladies, so forget everything you learned in birthing clinic. Fellas, come back. And then where else during the day? Well, red lights in the car, that's a good time. You can sitting down, you can, once you know what you're supposed to be doing, do reps of 10, 12, 3 or 4 times. And yeah.
I was just doing mine while you were talking. I was just doing my own pelvic floor exercise. It's something you can do without anybody knowing. And I do them all the time. It's become a habit now. It's almost become a habit. But okay, we are sort of being pushed for time. But so I might just carry on for this next question. And this is a question, actually, so the guy who maybe Deb first in Karen, could you jump in on this? One of the members, incontinence following prostatectomy, pelvic floor exercises were unsuccessful in his efforts to regain continence. After about 12 months, he had a sling implanted. This was also unsuccessful. His PSA is on the rise again, started with radiation. Before he started this treatment, he had been seeking information from us, PCFA, on whether radiation could worsen his incontinence. His surgeon also mentioned Botox of the bladder may help reduce his incontinence. So in cases like this, where you are exhausting quite a lot of conservative and other surgical treatments, what are the risks of incontinence with radiation therapy? Will radiation therapy worsen incontinence from radical prostatectomy? In fact, I'll just ask that question first about radiation, maybe to Deb, and then, Karen, if you wanted to jump in.
Yeah, absolutely. So, in most situations, they would try and wait after radical prostatectomy for the continence to be resolved or to get to a level whereby they are comfortable before, commencing salvage radiation, because there can be a slight increased risk of, leakage or urinary incontinence in some men with radiation on the back of already having a radical prostatectomy. Initially, whilst undergoing the radiation treatment, there can be that urge and that frequency, and then really for up to about 12 weeks or 3 months after completion of radiation, until all that sort of swelling and bruising from the radiation sort of settles down, then men may find that they regress a little bit, and we would encourage them again to continue with their pelvic floor exercises, perhaps go back to their physio who can then adjust the exercises during this time. They may need to just reduce them a little bit to allow that healing, and then as Ian said, going back, continuing to have reviews, then they can sort of be ramped up and pushed a bit more once all that initial treatment is over, to get them back to that level that they were at prior to the radiation.
Okay, I will come to you in a second, Karen, with the same question, but Deb, while I've got you. And what about Botox?
Yeah, so Botox to the bladder is something that's been used for quite a while in a lot of scenarios. In this situation, the man would need to have a full assessment of if they felt that Botox was going to help. So sometimes it does mean a referral to a different urologist, so someone who manages functional bladder conditions rather than someone who does radical prostatectomies. So often they are different urology specialists, and they may need to have some investigations called urodynamics, where they actually do a study that can be done in a clinic or outpatients area, where they really look at the cause of the incontinence and make sure, that if they are going to have Botox, that it is actually going to help. So Botox is then injected into, if that's what they go ahead with, into the bladder wall muscle. So like the muscles of the skin, the bladder wall muscle can assist with controlling the urine flow. It helps generally that urge incontinence or that overactive bladder that we spoke about previously. Botox is covered by Medicare, and if the men have already been assessed and they've tried medications orally and worked out that no, they need to go to this next level, then it will, it can be done in the public setting or the private setting and covered by Medicare. Generally, they would then review the patients about 3 months later, and if there's been greater than 50% improvement in the recorded level of leakage, then they can go on to have ongoing regular treatments of these Botox injections.
Okay, great. I don't know, Karen, do you have any further sort of comments on radiation or Botox?
Yeah, I think everything that Debra said, it was great. And I think just to be prepared and understand the expectations and, the potential for increased leakage and, a little bit more sensitive down that area. So, preparing for that. And then also knowing that it's for now, but also, keeping an eye on the leakage and then adjusting the products to suit, and then, keeping in contact with, the healthcare professionals. So, that you are, progressing along the expectation, of the treatment, if you like. But I think it's just keep an eye on things and, adjusting, and it's not forever. Things are going to change again. So I think that's the message, from me. Yeah.
Okay, wonderful. I think we're right on the hour, maybe just a minute or two afterwards, but so many great questions there and answers. If anyone in our audience has got questions that haven't been answered, just get in touch with the PCFA via the email. It's tellingnurse@pcfa.org.au or by calling 1-800-220099. So finally, key takeaways, go around the room. Ian, Karen, and then Deb, you've got less than a minute. What's your key take home from today that you want to really get across? Ian, Karen, and then Deb.
Okay, straight up, don't be afraid. Ask silly questions and be prepared to go forward 2 steps, go back 1, go forward 2 steps. That'd be my takeaway.
Well, Karen.
Yeah, as what Ian said, be prepared, get to your appointments. That's the most important thing. Your healthcare professionals, your exercise programs, the gym, your socialising, all those sort of things. But feel confident in doing that and well protected.
Wonderful. And finally, but not leastly, Deb.
I would say always keep your treating team informed with your symptoms. Don't presume this is normal and put up with it. Investigation to the cause of the leakage and the incontinence is always helpful and required. The prostate cancer specialist nurses at the sites and the tele nurses, if you don't have access to a specialist nurse in your area, can provide the wide range of continence products. We can talk to you, we can explain them to you to help you find something that's right for you and your activity and maintain your quality of life. Talk to your GP and also get those government funding programs to help with the costs, because they are there to help you.
Wonderful. All right, well, thank you. Thank you to all three of you. I found that a very, very exciting discussion, and it is one that we don't discuss enough, and I'm hoping that when men or carers see this, they share it. It's really important to share these vodcasts, comment on these vodcasts, talk about these things. I think as guys, we do need to do this a lot more. I wanted to thank also the major partners, TENA and Boston Scientific, for their support. We couldn't do this without support like that. Just a reminder that people can call 1-800-220099 for information or advice, or go to www.pcfa.org.au to learn more. With that, I wanted to again thank the panelists because it was amazing, and thank everybody who's listening, and see you all next time. Thank you so much, and goodbye.